Teams, and I tried to figure this out, and I thought I had it down, so now I got it. Okay, here we are. So here's our operations team. We have Karen and Tracy here with us. Marion DeBacher is the director of Office of Clinical Trials, where the Encore project is working under. For those financial folks, or when you as a coordinator are working with your financial teams will be trained and directed to talk to Scott Strybick. He's moving that effort to the use of Financials Console with Encore and working with the Epic billing team, and Tracy's working very closely with that and the charge master. And then you have me and Tracy. So that's who's who going forward. So we're going to first start out with where we are and where we're going to be with Encore. And we're in scope, and in scope, we're in Sprint 2. Sprint 2 is all the active, quote unquote, protocols in CRMS. Active meaning they could be active enrolling or active not enrolling and still seeing subjects for follow-up visits, or maybe still in data analysis. And there will be additional information about that whole process coming shortly. Laura, I think you got the invite for the research managers monthly connection meeting starting tomorrow, and that will give us more information about the migration of the studies from CRMS. And this go around, we are adding the SAP integration so that we can use our financials module for our invoicing and reconciliation of charges. Users will not just be oncology and some of the School of Medicine PIs, but it's everybody else. So the rest of the School of Medicine, all children's, and the community hospitals where they also do research are coming into this. So that means we have between 900 and 1,000 new users coming into Encore for this sprint. Training will begin at the end of February. I think many of you might have already received an email or should be receiving information about signing up for training. If that is not so, please let me know. And go live is set for the end of April. So we have a few months, but if you're working on the project, those few months go quite quickly. So keep an eye out for information from Encore team and any information that you see about Encore, because it will come sooner than you think, and we want you to be prepared. So this is where we are with CRMS. If you look in the middle there, you see the protocols, reviews, subject enrollment, and follow-up statuses or are kept in CRMS, and some other information. But I think a School of Medicine did not make this a mandatory system. Sometimes teams were dependent on, you had to use this for some things, but you didn't really, not you particular, but some teams didn't really follow up with all their subjects or kept things up to date, and they managed their protocols and their subjects in other ways that were more conducive to what they knew how to do or what they wanted to do. We had some protocol information, much of the protocols and reviews, obviously that comes from the EIRB, and some of the protocol details went to Epic. And then when you added your subject, connected them to a study, that too went to Epic so that we could do the hold on the research billing. But as you can see in the upper column or the row there, Vestigo, the IDS, and the SAP for financials, they weren't connected. So there was all this separate communication that had to go through, some other means, some other Excel or Word or email to pass on this information. So it's very, I don't want to say very limited, but yeah, there is some limited information in CRMS. But with Encore now, as you keep your eye on that middle row there, you'll see how we're going to be able to expand our activities within one system. So not only will we have protocols and reviews from EIRB, but we will be getting additional information from the EIRB to contain that is held in Encore that was not held in CRMS. And more information about the protocol will be going to Epic because there's more functionality on down the line. So we have calendars, coverage analysis, and budgeting. This is what Karen was referring to. So your calendars is your electronic schedule of events that you find in your protocol. It's your procedures on the left and your visits on the right and over across the top, and then your X's in the middle there to show you what procedures happen at what visits. So all that information will be built for you by Karen's team, And the coverage analysis and the budgeting, if they do that, they'll do the coverage analysis, but the budgeting that kind of depends on what that association is. Your finance team might be adding that information to Encore, or it might be the CRSS team. Going into adding subjects, you will not only just add the subjects and put them through the paces of the various statuses, but you will also be tracking their visits. Each subject will have their own schedule of events per protocol, and you will be able to go into Encore to say what visit occurred. Maybe a procedure didn't happen, so you'll mark that. Maybe you added a procedure that you had to repeat or something. You will be able to add that to this calendar. And that information is going to flow on to the financial team so that they can see exactly what happened on your protocol or various protocols at once. They can bundle all those items into an invoice, communicate with SAP to get additional information, and maybe some information is coming in from Phoebe also. The sponsor, the invoice will be sent out to the sponsor. This is, of course, the happy path, and the sponsor sends back the money that was exactly on that invoice, and you can reconcile it just like you do your bank statement. But there are obviously nuances because that always doesn't happen so seamlessly and so easily. But with all these other arrows going back and forth, these other systems above and below that Encore, you'll see now that we are communicating with IDS. The IDS team will be able to look at the protocol statuses and the individual subjects and the details about the subjects and their statuses so they can continue their work in their system. And the same with SAP, that information that only SAP has, there is a interface between the two systems that will communicate and send IO numbers, fund numbers, grant numbers to the invoice so that we can all keep track of this finances. And I will say that that's one of the biggest reasons that we're looking at, that we decided to use Encore, is it seems that some teams weren't accurately, not because they didn't want to, but maybe they just didn't have the resources or the knowledge or the experience to accurately budget for and or invoice for some of the items that they should have been. So this way, with everything, with the calendar build and the coverage analysis, kind of like it was before, that now we have financials, we have more people looking at what's going on in Encore, and it's all centralized. Hopefully we can increase our research revenue, because the calendar team will know what to add and know what to expect, and maybe there'll be some increased communication and increased collection of revenue for the study teams, and that means they can do more, and the team more not facilities, more computers or desks or more staff or something they can do with that revenue. So that's kind of one of the big end games here. So talking about the benefits of Encore. So as I mentioned, streamlining of protocol and study activities in one system is certainly a benefit, but standardizing trial management, everyone is going to be expected to do the same thing within Encore, because Encore, you have to use it in specific ways to get the benefits out of it, and for other areas of your study team to be able to get the benefit out and to know where they're going and to see the information that they need. It'll all be in Encore. So instead of emails going back and forth and sending Excel spreadsheets and checking off with each other, now your financial team will be able to look into Encore. Your regulatory team will be looking into Encore to see what's going on. So we're improving tracking of protocol details. Sponsors are looking for additional information from institutions. And with CRMS, we really couldn't provide that information because we weren't, excuse me, collecting it in a meaningful way. Well, Encore, as I'll show you in a little bit, has a lot of different pieces of information that, as you get used to Encore and as you get used to seeing in there, especially Laura, maybe in your position, you can see, oh, there's these pieces of information I could put together in a report and take a look at, so understand my protocols better. So that's hopefully one of the benefits too. And your subject accrual information, it's not just your statuses, it's where they are in the calendar timeline, in their schedule of events, where they are in the study. Uniform in the second area here, our calendars are going to be uniform for tracking all of our billing events, and the invoice and revenue capture will be more uniform. Finance people have their own special training on how to do that. Like I mentioned before, the communication is more open and transparent in Encore, and you don't have to use your Excel spreadsheets that I hear a lot of teams were using just to track what was going on to send to your finance or your budget folks. Easily view calendars for the protocol and for subjects. We talked about being able to visit your subject visits within Encore. And then again, it's because everything's streamlined and in one system, it just makes for better communication and understanding of what's going on with the individual protocols. And with the benefit of the reports and searches that Encore offers, you get a better picture of your portfolio. You can add details, excuse me, create your own reports in the searches to add your own details about your specific protocol, or you're looking for a specific type of subject and specific status of subjects. Just get you a better picture and therefore a better understanding of your whole resource portfolio, maybe for a PI or maybe for a department or maybe for a specific division. So there, before we go into the next sneak peek, does anybody have any questions of what they've seen so far?
So I have a question for studies that don't have a PRA. So there are a number of studies that are social science studies that don't have blood draws or procedures, or I know a chemo study, he's simply interviewing people constantly. It's a one-on-one interview situation where they're doing like on a tablet some tests, but that doesn't go through Epic. It's not scheduled through Epic or billed in any way. Those studies still use CRMS to track their patients, but because they don't have a PRA, will that study still get built into Encore? And can they still use it simply to track patients, even if there's no budget or money involved?
Yes, Karen, you want to take care of that?
Yes, so our priority is studies that would have a PRA, so the potential to generate a patient charge. As we move forward, we will look at our bandwidth if we could add those, but that still does not prevent the study team from actually adding certain time points. I mean, we can train you to do that, and you can do it in Encore. In addition, we're also, as you probably the continuing review reports that we submit now that come out of CRMS that we send to the IRB. We're meeting with them this week to look at, because they don't actually have a canned report in Encore, but we're looking at what fields do they need and how can we ask Advara to build us that report moving forward. So the short answer is, priority is anything with the potential to generate a charge, aka the PRA. The calendars will be built. If we do have time, we'll build those for those non required PRA studies. Otherwise, the study teams, Tracy can work directly with the study teams of how to get that information in Encore for you.
Okay, so will those studies they won't automatically then transfer over to Encore because there won't necessarily be a build in Encore?
All studies will be pulled in from EIRB regardless of a need for a calendar. So all studies will be present in Encore. And even without a calendar, study teams can track accrual and patient status. You just don't have the ability to do the individual visit tracking.
Okay, great. That's helpful. Because I think there are a number of people here who have studies without PRAs.
Mm-hmm.
Yeah, and there's going to be a great benefit to those study teams as well, because they'll, again, you'll be able to track your accrual and patient status, and then the reporting, which Lisa's going to go into in detail in a little bit, but yeah, no, definitely all of the studies will be there.
Okay, thanks.
Mm-hmm.
Okay, thanks, Laura. That's good conversations. All right, let's go take a sneak peek. And I know Laura and Akima, if you want to make any comments based on your training that you've had for the team, you feel free to just pop right in here. Okay, here we go. So, protocol details page. You see there's a lot of boxes. It's not real pretty, But once you get used to what's here, you'll see there's just a plethora of information compared to what you had before. So we're going to go into each individual area just a bit. Your banner and your PC console. Console is a term that OnCore uses to talk about the section that you're in, or the book of this volume of information that you're in. It's for protocols, and go as you see here, you have your protocol number, which will be the IRB in the production, the IRB number. You know, your PI, your sponsor, and the status of the protocol. And of course, your accrual is right there in the middle because that's very important to your study. Moving over to the left-hand side, you'll see these vertical tabs. Each tab has additional information within it. You'll see the main tab that we're looking at. Treatment has to do with an arm. Institution is where your subjects are coming from. Is it Bayview? Is it a different hospital? Is it campus? Your accrual will show you that a nice little chart of what subjects are accrued and what status and the dates that they met there, or that they consented, the dates they went on or off study. Your status is your where IRB information. Status is your protocol status. Your reviews going on down the tabs there is where your IRB information lives. Documents can be stored here, and I will just caution you from experience, I don't know that you want to dump every document possible here. I think you want to be judicious in what you decide is useful for a majority of folks who will be using OnCore, and use that here. Otherwise, it gets extremely messy and hard to find. But that's up to you as a study team, what you want to store there. Your eligibility is there, but I want to jump down to your protocol calendar. This calendar will show you if you would like to see all the arms if you have a multiple arm study, or if you just have one arm if you have a calendar built. It will show you the visits, and it will show you what items are expected to occur at each visit. Then you have notifications, deviations, and you'll get more of that information in your training session, but I just want to give you an idea of what's here. So if we go across to the red box for the body of this screen, you'll see those horizontal additional details. Most of this information will be coming in from the EIRB. However, there are some fields that study teams will need to complete in order to get the full functionality of it out of OnCore. And if you wonder, how will you know what's going to come in from EIRB versus what you're going to have to populate? Well, we have a document that we will share later on in this process in the next few months. It'll be a document to tell you where each field is coming from, who's expected to populate it, what to populate it with. So some information just was not stored in EIRB on the IRB application and could not come into OnCore. So we'll be getting that information out to you later. But the more information here, I want you just to give you an example. You have your department, your NCT number, your titles, your IRB number will be your protocol number. And below, and again, this information is coming straight from the EIRB. And below that box, there are some fields here you see are populated. Some information is coming from EIRB or clinicaltrials.gov. Excuse me. And some fields will be just defaulted from OnCore. And again, those fields that are here will be explained later in that document, so you know what to complete. So we're trying to make this easy for you, make this transition smoother, because it's going to be, some changes. It's going to be what you did before, but in a more robust fashion. Subject status. Here we are in the CRA console. There's that console word again. CRA is just clinical research associate. So whoever is managing the subjects would come here to this console to add your subjects. And I'm sorry, not add to sub, but to see the list of subjects that are on this protocol. So say that protocol, you've worked on it a while and you've pulled in various subjects, and some are you see over here to the right, you see statuses. Some are eligible, some are on treatment, some are just consented. That's where you're going to see your subjects for your protocols. And your MRN is highlighted in blue. That means that's going to be a hyperlink to something else. And where that goes is your subject calendar. And that's where we're going to go to next. So you have your protocol, you went to your CRA console, you're looking for your subject because you had a visit, and you want to mark that visit occurred. And this is what your calendar is going to look like. As you can see, we have some sections broken out that we'll talk about here. We have your statuses on the left, and then the calendar itself that we'll get into. So let's look at that individual status. So this is the subject statuses that you must go through. I know in CRMS, if you've used that, you maybe weren't there not too many consequences if you didn't finish your subject statuses. Well, here the consequences are if you don't go through this whole roll of statuses, is you won't be able to see your subject calendar. You won't be able to manage those visits. And if you don't have a calendar, then you just, this is just where you want to manage your subjects here. So you have your, obviously your demographics will pull over from Epic when you register your subject using the EMRN number. You would enter the consent date. You will tell the system that the subject is eligible or not. That's where the system's going to count how many screen fails, so you can get reimbursement for that from your sponsor. Then you go to on study and then treatment, and those tabs will help open up the various visits on your calendar. So looking at the calendar, this should look familiar in a way from the one in your protocol with your procedures and your visits. So if we go across the horizontal, that red box there, you will see blue hyperlinks. Those are the visit names. And when we click on one of those, it will take you to the visit tracking sheet, which we'll look at in a moment. These planned dates, you see the dates that are already populated there. That's because when the calendar was built, the windows were built into each visit. And when I enrolled this subject, I entered the consent date. That consent date is mathematically calculated within OnCore based on the way those windows are built in, and will give you your target dates for each visit. Now, that doesn't mean that you have to stick with these visit dates. You can change them. And if you change the visit date to something outside the parameter of that window, it'll give you a soft edit, but it's just kind of warning you. But those dates can change. And going down, you see I've already occurred a couple visits in this calendar for this protocol. And occurred, I'll just let you know, is another term that OnCore uses to say that this visit did happen. And then that visit date, it was, we're just going with the target date, but of course it can change because we know subjects don't always come in on the expected target date. So we can change that. So let's go look at what happens when we click that visit date. So here, let's look at what my screening date was. So I clicked that blue hyperlink that you saw on that other screenshot there. And if you look here in the dark blue where it says subject visit date, go down to the next light blue visit details and go over to the right-hand side, you will see phase treatment visit, optional genotype screening visit. So that's the name of the visit that I'm on, because as you get working in these visit details, you might just think, okay, what visit am I on? So that's where that information is. If we go to the left hand, let's follow the red stars here. And the visit date, again, that's coming from your calendar because it's based on your windows and your target date, and it can be changed. You can see that little calendar icon. The second red star shows you your visit status. Right now it's planned, like I didn't do anything, but if I were actually keeping this, I would mark it occurred. And sometimes this visit does not apply to a particular subject, or the subject didn't come in, so they're just going to miss this visit. Sometimes you can reschedule the visit, and that's fine. You just reschedule it and put the new date in there. So you can manage, this is what we call managing a visit, because it's not always occurred, which means it happened, but it's managed. Sometimes it might be NA or missed. So if we go down to the third red star, that's where you're going to be looking at the procedures that occurred at that visit that day. And it's kind of like a checklist for you. And I want to also, someplace else that you might learn on in training, or we'll talk about at another time, is you can print out these visit tracking and use them as like a visit checklist for yourself. But if you go down, a coordinator would go down the visits to make sure everything happened. Sometimes, especially at a screening visit, your procedures might happen on a different day than what your initial screening visit was. You can enter that specific date in that second column there towards the middle that says procedure date. You can enter that different date there. And if you go across to the right-hand side, you'll see a missed and an NA column. If your procedure did not happen that day, that's where you would mark one of those boxes. And when you do that, the beauty of this and being in one system is when you mark one of those boxes, the system is thinking, hey, this was supposed to happen. This already went through coverage analysis, and we were this, I was told, this system was saying, I was told that this was supposed to happen. Why didn't this happen? So when you click one of those boxes, a pop-up will come up and it'll ask you for the reason that you clicked that box. And when you enter that reason is going to flow down to the financial module. So your your financial team will see why a procedure did not occur, because you don't want them billing, you don't want them to bill or invoice for something that didn't happen. So they have to understand why you're not doing it, because it's a change in the calendar. Conversely, if you want to add a procedure for whatever reason, maybe you needed to repeat a blood draw from a previous visit, because maybe the previous visit they weren't a good stick that time. So you want to add a procedure, you're allowed to do that. And again, you're going to have add a reason why you're adding a procedure so that we keep up with that coverage analysis. So that's just a little idea of what it looks like and what you can do within the calendar. And lastly, as I was mentioning, how your information that you're doing as a study coordinator, when you manage those visits, it flows down to the financial console. So you will never see a screen like this, but I want you to see how what you're doing in that calendar is very important, because your milestones and your pass-through items and the way the calendar is built, you might have protocol items. It might be time for an IRB renewal or a monitor visit. It just depends on the way that the calendar is built for a protocol. And those items will pop up in your invoiceable items screen for your financial team to use when they are going to invoice the sponsor. So I just want you to see how your information, that what you're doing, is very important as we flow downstream. Laura, I see you popping up. Do you have a question?
So Pat put a question in the chat. Does someone have to go in and enter that these items occurred after the visit, or will it pull information from Epic? And Tracy actually just replied, these updates happen in OnCore, but does it happen automatically, or does someone have to type it in?
Sorry, it's done in Encore by whoever's designated to do that work. I just want to point out here, though, if everything happens as planned, it's as simple as entering in a visit date, and it's usually pre-populated with whatever the plan date was. So you can type T for today, you can type in the date itself, and then hitting the radio button that coincides with what's going on. So if the visit occurred and everything happened as planned, it's simply the date and the radio button and click submit. I mean, the workflow itself is very easy and minimal. The only time you get into like the lower levels there is if something changed, and if you had a visit variance or something that went differently, and then you would just simply document it there. And the reason you document it there is to provide that information then to your financial folks who are going to be managing then the invoices for your study. So that's
so if everything happened on that day as planned, you just click occurred and it all will fill in itself.
Yeah, it's really that simple. It's very full when you look at it visually. It's kind of overwhelming when you see all these fields and boxes, but to pare it down to its minimal, if everything happens as planned, it's the date, the radio button, and submit. So, and then the workflows in Epic are going to be the same. This feeds into Epic and will send patient statuses and study statuses into Epic. But the workflows in Epic are the same that you're used to, with the addition of adding the patient to a timeline. If your study has a calendar. And that, obviously, if you don't have calendars, then that's not going to apply to you.
Okay, thanks.
You're welcome.
Okay, just a little bit about reports and searches. This is one of the benefits, I think, that over time, as you get used to the fields, as you get used to how OnCore flows, people will be asking you questions. I think you'll your mind will start turning, say, hey, can I make that question into a report, or can I do a search for myself within OnCore with all the data that's in here? And the answer is yes, yes, you can. So some samples of the reporting here, you have a lot of financial reports, and I know your financial team will be able to use these to help them navigate all the items that they'll be looking at per protocol or for your department. IRB information can be here. If you're in regulatory, you can pull out some of these canned reports might be helpful. Subject visits definitely are ones that I look at for the Sprint 1 teams. If you want to make sure that you are keeping track or that you are occurring all the visits that you should have, this report will tell you if you have marked them as occurred or if you've managed them or not, or if it'll tell you, as sometimes it happens, as I've used for the Sprint 1 teams, oh, the last week they had 2 visits they forgot to go into OnCore and track, because it's a learning it's a learning process to put this into your workflow. Oh, now I have to go into OnCore and I have to manage this so our financials will be happy and our revenues will increase. So, sometimes they forgot a visit or two, or they had a lot of visits they had to manage. So I use those for a little bit of QA. So those are very helpful. And your monitoring reports, your accruals. We have some reports. It depends on what you're looking for. Some of these canned reports might be helpful to you. But as Karen mentioned earlier, for the specific IRB review, the update for IRB renewals, we are looking for one that will be more specific to our needs. And if you see at the very top there where it says development coming late summer 2024, we know the report section is very important and very beneficial for this system. But because we're working so diligently, the OnCore team is working so diligently and adding, working on the migration, getting the systems to communicate, getting all the data flow to come from one old system to a new system, making sure we're communicating with all the rest of the School of Medication, School of Medicine, that's taking priority right now. So once we get that flow, once we get through a go live, once we get some of that experience under our belt, and once we go through Sprint 3, which is the e-reg system within OnCore coming in July, more attention will be paid to doing custom reports and working with the data warehouse and the data for the reporting systems that OnCore has that we're feeding into to create the reports that will be helpful to you. But there are some canned reports. What I'm trying to say is there are more canned reports that you can use, take a look at, but until you get a lot of data in there, there's not a whole lot of information you can pull out. So give it a few months and visit some of these reports. And the next feature that I think you're going to find very handy is once you get used to what's in OnCore is what we call a search function. And it's not just searching, but a search is actually creating your own custom report, your own information for your specific group of protocols or for your one protocol. What if your PI comes and asks you some specific question about, say Laura, someone, the head of CFAR says, hey, tell me about all the studies that are going on in CFAR and what PIs are working on those and what are open to accrual and what is their accrual. You can put all those pieces of information in this search function and it'll provide a nice table for you of all that information. So the great thing about searches is you can run them and you can save them. You can easily change them. You can, if the report doesn't show what you want, you can hit the back to search button and it'll take you right back to where you were, so you can change and add columns or take away columns. You can drill down a little deeper if you want to. And once you save them, you can run them again. Once you find one that just works for you, you can just keep running that thing. You can share it. You can send it to other team members to say, hey, I got this great report that I'm finding when I do a subject search. This is really helpful to me. And you can share that with others. The only thing about the search is that you are limited to what you can search by based on what studies you are assigned to. Or if you have a departmental assignment or permissions, you can pull those group of protocols and subjects together. But if you are assigned to three protocols, you will only be able to search on those informations, those protocols to which you are assigned. And there's more about reports and searches that we're not going to get into here, but I want to highlight, what some of the functions are. And the examples are, okay, pull list of subjects enrollments over a period of time, something you might need to do. for your IRB renewal. If you need to know how many subjects went to on study, which is your accrued status, you can do that over the last 3 months or over the last year. Check the accruals of protocols under a specific PI. How busy is this PI? Well, there you go. You can pull that one only. If you want to monitor your the number of protocols in your Laura, but I thought I already talked about this. If you want to see how many you have in your area, you can pull something like that. And then if you want to see certain subjects at a particular status, how many are already off study or on study, you can drill down to ask specific questions like that. There are dozens of fields that are open to a search. Not every single field, but as you get used to search function, you'll see what fields are available. But it's a good 80, 90 some percent of the fields that are in OnCore you can use as search. So I think that'll be very beneficial for you going forward. So next, what do we have in store to help you get used to this new system and to help you understand its workflow and how it can work into your own workflow? So one of the things we have is lunch and learns. They will start in March on Wednesdays, and they are going, the screens that we looked at in this presentation, I'll be going into a deeper dive in those presentations just to give you another layer of education, just to hear something, to let it sink in and how you can use it and what's there. And maybe it's something you don't need to worry about. So you can ignore that and move on to another tab or another area. So those lunch and learns would be about 4 to 6 of them, I think, on Wednesdays. Training obviously will be coming at the end of February that you will all participate in most likely. It comes in 2 parts, 2 instructor-led 2-hour courses, one for protocol section, one for the subjects. And then each area has a bundle of e-learnings that you will need to listen to and participate in by taking an assessment after each one. And those are all going through the My Learning system. So once you get the email from the trainers, or in this slide deck that I'll share pretty soon, that has the link to the hub, the research hub, Johns Hopkins Research Hub that has all the information about OnCore. Talk about that in a second, so you can sign up for training there. And then our Encore monthly connection, this is geared toward, but not only exclusively, but geared towards the research managers or the team leads or the research supervisors. Those with some kind of delegation authority, because there will be some activities as time goes on that you as a study team will need to talk about, how you're going to manage the migration, how you're going to manage the validation, who's going to enter the financial staff, things like that. So these monthly meetings will be led by me, and Marion and Tracy will be involved with this. And after OnCore, the OCT, the Office of Clinical Trials, will continue these probably on a bi-monthly time frame to pass on updates about research, what's going on at Hopkins, new systems or old systems, or how to make changes to certain activities in OnCore. So I think that will be very beneficial. Those research managers should be passing on that information to you as part of the study team. And if they don't, please ask them about, hey, did you go to that meeting? Did you learn anything? Do we need to be prepared? So we're trying to hopefully that gets the word out there to everyone. And then later on, we'll start these open conversations, the coffee hour. Scott has already started his for the financials and the invoicing side. He started those last fall, and I had a few last fall with the non-oncology side, but now this is a larger lift. So these OnCore, these coffee hours are there just to help you if you have questions. To say you've gone through training and you saw something you weren't quite sure what it meant or how it applies to you, just pop into these coffee hours. Scott's are on Tuesday currently, mine will be on Friday, and we'll just talk. It's a time to pop in, ask your question, pop back out. You can hang in there. I'll probably try to bring in more information about different pieces of OnCore that you might not have learned or might not remembered, or just let you remember, hey, you can reset the calendar. Did you know that? So we'll go over that. So just another layer of informative, nothing mandatory. And the links to those items will be on the website. And I'm just looking at the chart here. Yeah, Tracy, I know she had to pop off. And I'm just looking at the chat, not chart, sorry. Okay, and lastly, next steps, what to expect going forward. So if any of you know of other people who might not be included in the information that I'm sending out, or have not received emails, have not heard from me, or somebody from the Encore team that maybe you think they should, please let me know. We need you to confirm your Encore user list. Identify, let's see, Laura, I guess your team, I'm not sure how unified your team is because all these people are in different areas, but usually for a department or division, we ask for a super user. Identify a super user who will be like their one of their point people to go into or attend the super user or the certified trainer. They have a once a month meeting to get details about what's up and coming. So super users are helpful. Laura, you popped on. Did you want to say something? Okay. And then we have, like I mentioned, the managers meetings once a month. But again, that's for anyone who wants to attend. They can attend those, but mainly for the managers. Here's that link to the research hub. So this is everything Encore, your tips and tricks, your how to sign up for training, your FAQs, if you need help, how to get to the help desk. That information is all here. The newsletters, that's something that comes out once a month. It just gives you an idea about what the team is doing. It's not just, oh yeah, this is what the team is doing. We're working so hard for this, but this is how it's going to affect you, what you might need to be aware of, or what changes are coming, or know that in the next couple months, the migration list is coming out and what to do with that. So please link up to these and look at them and just prepared. Maybe, not maybe, but it would be ideal to favorite them, because if you lose your link to where to go to manage your visits once production and go live comes, it's going to be right there in the research hub. And lastly, just watch out for anything Encore. If I'm sending you something, if Tracy's sending you something in time, if the CRSS team is sending you something about your calendars, when those are built eventually, please respond to those, because we have a whole flow of information that is dependent upon your information. And in reverse, we'll do our best to get questions answered back to you. And lastly, just let us know how we can help. If you ever catch me or Tracy or Karen or Marion or Scott on any calls, or you grab us, find our emails or Teams us, please feel free to communicate with us, because even though we've been through this as an Encore team through Sprint 1, this is a lot larger and more varied types of protocols, more varied types of teams. Not every team has a staff member for every function. We have many teams in School of Medicine that's just one person and one PI. So we have to cater differently to different people, and we're learning that as we go. So please be patient with us as we understand, oh, we didn't have that question asked before, so we need to find an answer to that. And conversely, we're always going to be there to learn from you as well. So that's all I have. And at this time, is there time for questions?
I don't have a question, but I have a comment.
Sure.
And my comment is that from what I have seen in Encore, I think it's going to be very helpful, in the sense that the research that I am involved in, we have 500 patients to follow, and we see them every 6 months.
Oh,
So tracking the patients has been very difficult.
yeah.
Because you don't know which patient is supposed to come when. You have to go back to the Excel file to look at the last visit. And if you omit the last visit, you would not notice that the patient was seen maybe 2 or 3 months ago, until you go for the payment section, and then you realize that the patient was paid 3 months ago, and the patient has finished the test. So if you have this tracking system, you'll be able to see it, to know which patient is supposed to come and when the next visit is supposed to come. So I'm just saying that it's going to be very helpful to people like us.
That's awesome to hear. And that's what we're hoping, that you can see the benefits to this. And as Karen was mentioning before, if that's one of your survey questions, that might be a candidate for their team to be able to build a calendar for, if they have the bandwidth, so you can keep track of not just your subjects, but where they are, those 6-month visitations. Yeah.
Like,
Harris, I see. Oh, go ahead, Laura.
I was gonna say Harris has a question.
Okay.
Hi, thanks, Lisa, for the presentation.
Sure.
Just a quick question. I think you said in the beginning that we have to reach out to you for the training. Is that right? Or are we going to
Well,
receive an email?
you should be receiving emails from the training team already. Oh, not already, but currently.
Okay.
Training is open. I actually don't know exactly where they are in getting all the emails out, but that is certainly something that if you have not received it yet, yeah, I mean, I'm taking your name down now, but if anybody else there has not received a training email, I can check into that. It might just be a lack of communication. I will tell you, just so you're informed, and you can take this back to the rest of your various teams. So this is good to know. This has been quite a task to identify in the School of Medicine who needs OnCore training and who doesn't, who needs to know about this, and who doesn't. Apparently Hopkins didn't keep I don't know, they just didn't really keep track of who was who and who was not who as far as research goes. There are different systems that handle different information, like for the financials, and they know some people, but the financials team don't know everybody that's on the team. And then it's a matter of who has a authority is not the word, a supervisory permissions over what teams. It's finding who is that supervisor that knows about that study team. So it's been a little heavy lift, and if I apologize if we haven't gotten to you or haven't found out who you are. So please let me know who has not received training. You can email me or Teams me. I see someone put something else in the chat.
So I'll just say that after this meeting, I'm going to send an email out to our listserv, which includes about 80 people. So not everybody's even here. And it'll have the link to the Research Hub. It'll have the CRSS email. And I'll just mention in that email to everyone that if you have not received training emails, I'll put your contact information, Lisa, so people can reach you directly, because
yeah, and
not everybody here has a full name, or nobody has their JEDs up really, so you wouldn't be able to reach them through this anyway.
And if you get Laura's email with that hub that Tracy has put in the chat there, if you get this before you get the formal invitation from the trainers, when you open up the hub, there's a big box right there on the left-hand side that says OnCore training. So just click on that box and that'll take you to the catalog of training. And most of you will probably, you can scroll through, but most of you will probably take the research coordinator training. That will give you your protocols and your subject details of how you need to sign up. And there's even a little link on there that shows you how to sign up, and there's some videos in there of how to sign up and where to go. It's My Learning. You're probably very familiar with that already. But yeah, go ahead and if you get that website, go ahead and click on that and open up and sign yourself up. But I have made notes to and Laura, I'm going to contact the training team to see, and I'll check my lists to maybe I can do a comparison. If you could somehow send me that list of 80 people, and I can see, and I don't know if you happen to have their department, because they might be on a general internal medicine, they might be in ID, they might be in another department. I know that it's going to take some time to kind of find them, but yeah, I can at least check with the trainers.
Yeah, I just have email addresses, so that won't indicate departments.
Okay, well, I can I'll try to do a comparison somehow of the emails that I have versus the emails that you give me. Or I'll just send them to the training team and say, hey, can you send them out? But you don't need that email is what I'm trying to say. You don't need that email to sign up for training. You can go to the hub on that link, click that training button and find the course catalog and sign up for that.
So I know Lisa has to leave in a couple minutes. Does anybody have any other questions right now? you might all be shell shocked and just not even know what
I
to
know.
ask.
That's,
So I've
right.
gone through the training and I've listened to a couple of these. So each time you hear it, it makes a little more sense. I think the first time it's just so new and fresh, it's hard to make sense of it. But the more you see it, the more it does make sense. And now that you've seen your first pass, when you go through the training, it'll even make a little more sense.
Yeah, and we have the lunch and learns and the coffee hours and or coffee connections, whatever they're called. I know you have busy days, but if you want to pop into any of those, feel free to do so. Well, thank you, everyone. Laura, thank you for this opportunity. Karen, I'm glad you were here to help fill in details about the process too.
Yeah, and maybe in the future, if people, after they've done training, maybe we'll have you come back
Yeah.
in 3 months or so and show us how to do builds on our own for teams that aren't going to get builds done by the finance people. That might be something helpful down the line for people that want to have calendars but don't have PRAs and don't have financial linkage needed. They still might want to keep track of their calendars, like Akima was saying.
Right. Yeah. And that's good. That's good to know, because one of the things that Encore also is doing is providing leadership with a picture of the protocols that their researchers are working on. I know you have the IRB, and the IRB has some information, but I think Encore is pulling a lot more protocol details, which is good for leadership and good for reporting to sponsors as well. So with all that, thank you everyone for all your work that you're doing for research. I was telling Laura before, I was at the University of Alabama at Birmingham working in infectious diseases, and that's where our CFAR was. And I was working on the HIV vaccine trials with the HVTN network and the ACTG. So you guys are very familiar to me. So thanks for all your work in that area.
Yeah, thanks for being here.
Okay, sure.
Okay.
Bye all.
Bye-bye.